All right, hello everybody, and I'm very excited to have Mettina Carroll with us today. She has a wealth of information on how technology is actually used with clients and patients, and how it really helps clients get their needs met, that they may not normally have gotten their needs met if it wasn't for connecting with them through the use of technology. So Mettina Carroll is a telephonic case manager for a global health insurance company. Her current role there is to provide telephonic case management services to developmentally disabled individuals as part of a health management organization for a public funded insurance plan. And as part of population health management, Mettina provides collaborative care delivery servicing the physical, mental, and financial needs of her members telephonically. So she's going to share some really helpful information for us. And so Mettina, thank you so much. And to start, maybe you could just kind of give like a summary, a brief summary of what it is that you provide.
Okay. Currently, my role is to work for the health management organization, helping disabled members and their caregivers to identify resources, help them to understand their benefits under their public insurance benefit plan, and help them to gain access to the resources that they're in need of based on their disability.
Okay. All right. So if it wasn't for connecting with them telephonically, it probably wouldn't happen. Is that right?
That's correct. That's correct. As a matter of fact, for our organization, we have clinicians, health coaches, and case managers throughout the world, actually, that provide this service. And some of our members can be anywhere in the United States. Or you could work specifically for a specific state based on what the need is for that state. But we have organizations that work for pregnant women who are in public funded insurance plans. We have people that work in disease management, helping the members who have chronic or comorbid diseases with their level, as well as what I do, which is provide additional preventative health information and referral and resource information to disabled members. So we work in a variety of different avenues, but it's all done telephonically.
Okay. Yeah, the preventative is so important. Is there been a lot of growth in terms of providing those kind of services, especially preventative care?
Absolutely. Exponentially. It is something that I actually started doing telephonic case management over 10 years ago for this company. And when I began providing this service, I actually worked in the disease management population, working with people with chronic comorbid diseases and helping teach them a little bit more on how to manage those diseases more effectively, and making sure that they had access to the doctors and the specialists they needed in order to manage that disease as well. And as we move into more of an HMO society, what we've done is we have taken the insurance plans that are being offered the member and offering this additional arm extension so that when they don't understand their benefit, or they're not able to access their plan, or they're having technical difficulty with accessing information on their plan, or locating providers, or locating equipment, or locating any type of resource, or even understanding what type of coverage they have for vision or dental or durable medical equipment. And our role is to work with them one-on-one, or work with their caregivers or their local case managers one-on-one, to make sure that they're educated with those benefits and that they have access to them. So we help find the doctors, we help them find the specialists, we help them find the equipment they need to do home screen of diabetes or of asthma care. We help link them to the different types specialists they need for their diseases. If it's diabetes, making sure they have an endocrinologist in their life. If they have chronic pulmonary lung disease, that they have a pulmonologist in their life who is measuring their lung function on an annual basis, or for a diabetic, their sugar levels on a semi-annual basis. We use a lot of tools, and I actually work for a division of the company that focuses only on the technology and the technology support of our members. So I use a variety of different types of search engines. My engines allow me to look at claims information, pharmacy information, and take that information, which is downloaded into the plan, and use that as a tool to help be able to better educate them on what preventative care measures are missing, whether it's child's immunizations or whether it's an adult who is in need of an annual flu vaccine, or a citizen who is in need of a pneumonia vaccine. We're able to identify those needs based on the information that is fed into the claims system, so that we can better educate each individual member based on their individual needs.
Wow, that's really neat, because a member themselves may not be aware of what they're missing because they don't have those tools.
Exactly.
Or would maybe not know how to use those tools. Yeah, that's right. Do you also connect with clinicians, providers that are providing services to the client?
Absolutely, absolutely. Once we do what we call an initial comprehensive health assessment on each member, we then contact their doctor and their local community case manager, so that they know that we are going to act as their medical arm extension to assist them with their medical care needs. We will send what we call the plan of care, which is based on their problems, their goals, and their interventions that address those problems. We send a copy of that to each and every one of our members, as well as their doctors and their caregivers if requested, so that they have that information, so that they know what recommendations we have based on our annual assessment, and what we would like to see as far as preventative care measures, or even intervention measures that are needed based on the current symptom or issue that they're having.
Right. And are there statistics on the impact of the services that you provide, the telephonic management? Are you aware of any statistics on that, the impact?
Absolutely, absolutely. The reason we have been so successful with this company and this HMO rollout of services for members is that we have been able to absolutely show the public funded insurance companies, specifically for what I'm managing now, how we have been able to reduce the number of hospital days that a member is in the hospital for. We shorten those days. We have been able to shorten the readmission dates for hospital admissions, teaching them alternatives to the emergency room, alternatives going to the hospital, helping them to learn how to use their doctor's after hours line, helping them to know how to use a crisis line, giving them an access to a nurse line that they can contact. We are able to show them the preventative measures that have increased and been completed on each and every member that will prevent them from having pneumonia, flu, shingles, immunizations for chickenpox, measles, everything. We're able to demonstrate how those preventative measures
yeah. And are there federal incentives for this kind of work that you're doing?
I don't work in the marketing part of the products.
Yeah.
I do know that our providers are given incentives in order to be in-network providers with our HMO. I know that we are rolling out new incentives for our members that help to encourage them to meet their preventative measure schedule.
Okay. All right.
Diagnosis or their disability.
Yeah. So Carol, when we spoke one time, you shared how some of your members struggle with reading, or they can't read or writing, and how you assist them, getting their services, locating their services, and assisting them around those challenges that they have. Can you touch upon that?
Yes, well, first of all, with many of our public funded insurance plans, through our contract with them, they have requested that, all educational materials that we mail to them regarding their diagnosis or management of their diagnosis be at fifth grade reading level, so that they have a better ability to comprehend and understand the educational materials we're sending. We also provide those materials in many other languages. We also are able to utilize a interpreter service that allows us to not just use the interpreter service both with conducting our assessments, but also we can even have the interpreter service do face-to-face or telephonic interpreter services for our members at their doctor's appointments.
Okay, excellent. And I know verifying members' identities are really important. And for the clinicians that I train, that's a very important thing to do, is to verify a client's identity. But I know sometimes that's also a challenge. Can you speak to that? How, why it's important, but also how it's a challenge at times?
Well, first, it's very, very important. It's very important as you are using this technology. The first thing you need to make sure that your member knows is that your call can be monitored by your company for quality training purposes. And you need to let them know that, so that they know that this information could be recorded. And the purpose of recording that is to make sure that we're doing our job correctly. And so every member is advised of that. But it's also important that you verify through all federal guidelines that we adhere to. Verify, the person's demographic information, so that you can say that you absolutely spoke to the member that you had outreached at that time. So you need to verify pieces of information that only that person may know, which would, things such as their address and their date of birth and their zip code and their diagnosis. And all of those things, and all of that must be done before you can begin any type of educational session with any of our members.
Yeah, excellent. And I know phone engagement, really getting the members engaged with you on the phone, is super important. I know for the federal government that's really important, having members engaged, because that's how they're going to get well, is if they actually engage the services that are provided. So working over the phone, what are some of the skills that you use to encourage engagement?
Well, it's important that at the very beginning of your session with your members that, as soon as you get through all of your HIPAA verification and your demographic verification and that type of thing, it's very important that you lead into your interview by letting them know who you are and what your role is in their life. Make sure that they understand that this is actually an additional excellent benefit that they are going to be receiving as part of their health plan, and that the reason that this benefit is there is to assist them with all their care needs. Once they understand that, it's so much easier to get the member engaged. When they see that you're going to help them through any red tape that they've had in the past, or any barriers they've had with getting a prescription filled, or giving them knowledge on how to access a wheelchair or a shower bench to help them with bathing as a disabled person. Once they understand that your role is to truly help them with their care needs and be there for them whenever they need you, that's how you get them engaged. So then the teaching that you do ongoing in the future sessions becomes so much more easy, because usually when you meet a member, he may have actually a lot of barriers that weren't addressed previously because they didn't have someone helping them manage their care. So you can put out those fires and address those immediate needs right then at the first, at that first interview. And that really does help to get them engaged for future sessions. Then go on to a future session where you're talking about, you know, your flu vaccine or your pneumonia vaccine. Because you have the knowledge as to why that flu vaccine is important for that member, due to their breathing condition or due to their age and, you know, with being compromised and other issues, once you're able to educate them in such a way that they understand, it's not just someone saying you need to get a flu vaccine. We are able to explain in full detail as to why every single screen is needed for every single member. And so that helps them to buy into it. And you want to make sure that they're engaged in the conversation. Before I begin the interview, I'll say, by the way, before we get started, is there anything that you would like immediate help with or something that you would like addressed before we do your assessment? And most of the time, they're going to say yes. As a matter of fact, I haven't been able to find a dermatologist in the area that takes my plan. You know, and it's like, okay, well, I can help that. Or my daughter needs a collapsible lightweight wheelchair. And I can say, okay, great, I can help you with that. So once I'm able to help them, you know, address those issues and actually help them to understand their benefits better, so they realize that their coverage is actually much better than they ever dreamed it was, for all the different care needs that they have, then it's a lot easier to keep them engaged for the future sessions.
Ah, okay. Wow. Yeah, that's fantastic. And is there anything else that would be helpful for listeners to know in terms of how you found like using electronic health record systems to be helpful? Maybe you probably see, I don't know if you see like members' medical records and making sure that it's accurate, or like trying to eliminate errors. Anything else that might be helpful? How you've being familiar with the culture in which you're engaged, the members' culture, how that's been helpful.
Okay.
What aspects would be helpful for us to hear about?
I'm going to touch on those as two separate issues.
Sure, yeah.
The record keeping is very important. I will tell you that in almost 10 years, I have not picked up paper and pencil. And that's actually a really good thing because, before I did this, before I worked in this type of case management, we always had paper and pencil to track our members' needs and clinical needs. However, we were constantly having to shred everything. Because this is confidential information. Well, we still have, everybody has a shredder, and we are to shred any document. But because this is such an ever-changing technology, we're not advised to actually even print off any information. Don't print off educational information or any information, because that information changes daily. And so if you the most up-to-date process, the most up-to-date clinical information, the most up-to-date everything, it is to get it directly from the providers as that information is taken. So we have very secure means to get our information from our doctors electronically. They go through a certain secure what they call right fax system to send us medical verification of information we need. We succumb to different types of standards. We have what they call a HEDIS review of clinical information, that we show verification of all the information that we receive from our doctors. Our offices, we keep that information secure and safe. We do have file cabinets, but again, they're very rarely used, but we are, we definitely know that we are trained to keep them locked at all times, keep our desk empty at all times, keep our computer locked and secured at all times, make sure that there's no information on your computer when you leave the room, make sure your computer is shut down when you are not in your room, make sure your door is locked when you are not in your room, make sure you have a fire extinguisher, make sure, you need to have a plan for every single part. You need to treat your home office like it is a business office. keep your record keeping and your reports in the same secure way you would as if you were working in a cubicle at an office. And we used to work in cubicles in the offices, so we know what that looks like. But it was also very important that, you know, those computers were not left, you know, open or unattended or confidential information on the desk, and make sure that everything was always locked and secured before you left it at night.
Yeah, those are fantastic pointers. And I like the pointer of even the fire extinguisher, because if there is a fire, being able to put it out quickly so the hard drive doesn't get destroyed could be very important. And just for safety. I mean, it's because that's not something I always think about, the fire extinguisher, having that right there in the office, home office. Yeah. What about understanding one's culture, the members' culture, how that's been helpful?
That has been very helpful. Our company does a really, really good job of providing training to us, and most of our training is mandatory training. So,
yeah.
So it is part of our contract to be educated in every area that would an individual or a client with case management. And cultural diversity, of course, is one of the most important. Understanding. We attend at least 20 hours of training annually to be culturally diverse, so that when working with different cultures, and we globally, we are in interaction with all of them. But even if you're working state by state, you will encounter several different cultures. And so you may have one culture whereby the family uses herbal supplements instead of medication, and you need to and respect what they're doing, but also be able to provide valuable information as to why the prescribed medication and a conversation with the doctor regarding both is important. May have a situation whereby there may be what they call the head of the household, who is the only person who is allowed to speak with the care manager regarding the care needs of a family member. And trying to be able to communicate to that person so that that person is able to get the information to the member that you're serving is very, very important. Sometimes different types of cultures will be a lot more private about their medical care needs. Some of them, even some of them have different opinions on what healthcare means to them. They may even have an opinion that they may be suspicious of medical doctor care. They may be private in their life and not want to share medical information or medical illness with an outside party. There's just so many different types of cultures out there that address medical care needs in different ways. So as part of our assessment process, we ask those questions of what is your religious background? What is your ethnic orientation? Does your cultural or spiritual or your religious belief impact any way how your medical care is provided to you? Whether it be a blood transfusion, that their spiritual background does not, that prohibits that type of care, we need to know that information so that we can educate our doctors properly, and so that we can also make sure their providers are also aware of what their background, ethnic or religious beliefs are regarding their medical care needs. We can address their medical issues if we know what their ethnic background is, because they will be handled in a different way in order to get them engaged and keep them engaged, in order to make sure we're able to continue to deliver the same level of care and service that we can with other members.
Right, yeah, that makes perfect sense. Being sensitive and responding to people's cultural and religious and ethnic background, I could really understand how that would help them remain engaged, because I could see if someone's not sensitive to that, it could really shut off a member immediately. Yeah, well, that's fantastic. This has been very, very helpful. It's been definitely has taught me some new things. I'm sure it's going to teach a lot of the listeners some new things. So thank you very, very much. It's been fantastic, and I'm so glad that you were able to give us your time. So thanks a lot, Mettina.
Thank you. Have a good day.
Yep. All right. Bye-bye.
Bye-bye.